I wanted to address a question that comes up in my office a lot. I'm a surgeon and I help people with their health in general. So a lot of people ask me, why don't you do bariatric surgery? I don't believe in it. And it's very profitable and it was easy. I mean, I've been doing surgery for over 30 years now. And I took the courses for lap band, I took the courses for bariatric surgery, and then I sat and, honestly, I did not feel like, sorry, I was reading something. I did not feel like it was for me because I believe more in exercising and discipline. But that's my prerogative. Plus, I feel it's too much of a radical operation. So when people ask me, should I do bariatric surgery or should I do the injections? Hands down, the injections. If your health allows. And now, there's a place where bariatric surgery is the best solution. Morbidly, extremely obese, your life is in danger. Yes, by all means do it. But, the operation in itself has complications, and you're basically rendering your body unable to absorb nutrients. The whole principal goal of bariatric surgery is malnutrition. And I am not disparaging. I'm going to get some hate from it. Bariatric surgeons, say whatever you want. That is the truth. And it's a permanent problem. And it's not a solve-all solution, just like the injections are not. You still have to change your habits. You still have to learn how to eat. And now you created a problem where you have to be dependent on minerals, vitamins, and assure that you get enough protein. My concern is this: as you age, what happens to your nutrition? What is the bigger problem that we have in our nation? Is many people are old and they are not eating enough protein. They lose muscle mass. They get very weak. They are unable to move around. They break bones and they end up in the hospital. Do you know the mortality of a broken hip is huge, especially in a 70, 80-year-old? So if you have bariatric surgery and you lose the weight, bravo, but then your nutrition will be compromised as you age, and it'll be a bigger compounding problem. If you do an injection, you lose the weight, you change your habits, you learn how to eat, you maintain that weight through exercise and eating the correct food. And if it's giving you side effects, you stop it and you get your nutrition back, or you're able to eat back. But there's no sense on going too aggressive, especially when you're younger and capable of doing your own exercise and your own plan of lifestyle adjustments. I think bariatric surgery is going to render a nation of people who are extremely malnourished and have a hard time keeping up muscle mass. This is what I have been very concerned about, because it's not using in a controlled fashion. I see people with BMIs barely above the norm trying to get the operation in desperation. It is not going to solve all your problems. It's going to create problems in the future for you. So the best thing you can do as you're watching this, if you're thinking, just get on the injection, especially if your glucose is a little bit out of control, you're a little diabetic, hurry up and do something. The other thing I try to explain to people, neither the injection or the bariatric surgery will improve your VO2 max and cardiovascular endurance. So you need to exercise. Exercise is going to be needed in any of them. And it's going to benefit everything. Exercise in the form of cardiovascular endurance, in the form of weightlifting and muscle building. So you have to change your habits. So the message here is this: if you're sitting there contemplating which one, talk to your doctor, of course, have them help you. Make sure it's not a bariatric surgeon telling you, because he will say surgery. And then just look at your health and do whatever you feel is going to help you now and in the long term. Don't forget the long term. Another thing to consider is both of them tend to cause problems with the gallbladder. Bariatric surgery more so. I take a lot of gallbladder from patients that had gastric sleeves. It's almost 100% of them show up sooner or later. Why is that? Well, you're not eating enough. When you eat, food hits the duodenum after it comes out of the stomach, and it stimulates the gallbladder. But if you're not eating a lot, that gallbladder is not being stimulated. The gallbladder has bile salts and cholesterol, calcium, and they just sit there. If you have a glass of salt and water and you don't move it, you don't empty it, it precipitates. That's what happens in the gallbladder. You're not eating enough, you're not stimulating that gallbladder. It happens if you diet too, but more aggressively in these situations because the stomach is full, and I think it also slows down the gallbladder, and you get gallstones. And gallstones will cause problems like pancreatitis and gallbladder infection, pain, and we have to remove the gallbladder. It's not the end of the world, but it's another operation you may buy yourself. So that's another reason why the injections to me make sense. You use them for the purpose. You lose the weight. And I have no interest in that. I do prescribe them, but I don't have any financial gain. I'm telling you the honest truth of what I think is the best. And you should think about this. This is meant to make people think. The injection, you stop it. It's a short term. It's a, you can do for a year, and then change your habits, and then wean off. Bariatric surgery, you're stuck with it for life. You can reverse a gastric bypass, but man, it's not an easy operation, and it's, you buy yourself a lot of issues. One more thing that I always tell people when they do the gastric bypass, just remember, you're bypassing the area of the stomach that is meant to have acid to the small intestine. So you're shoving all this acid, although it's decreased markedly because the stomach is basically crippled, but you're still getting acid. People get ulcers in their small intestine because of this acid that's not supposed to be there. Anyway, my opinion, it's too aggressive, and it's a little bit, you buy a problem for the future. Have a good day.